Hello everyone, I'm Sheldon Baker, Editor-at-Large for Innovision Health Media. My guest today is Dr. Hyla Cass, one of the nation's foremost experts, authors, and speakers in the field of integrative medicine and psychiatry. For over 30 years, Dr. Cass has helped countless individuals take charge of their mental and physical health. Known as the non-drug psychiatrist, she is recognized for helping individuals to withdraw from psychiatric medication and substances of abuse using natural means, including hemp oil, CBD, and other professional grade supplements. Thank you for being here today, Dr. Cass.
A pleasure. Thank you.
So what do you say is the most important number that we don't know?
This is so interesting. We know our cholesterol. We may know our hemoglobin. There's certain numbers you just your vitamin D level. But one number that I don't think most people know is their ratio between omega-6 and omega-3 fatty acids. So why should we care, right? It sounds kind of esoteric. And first of all, let me explain what an omega-6 and omega-3 fatty acid are. These are oils that are essential. That's why they're called essential fatty acids. So we have the 6 ones, the omega-6 and the omega-3. The omega-6 are seed oils, the things that are in the oils that most of us don't cook with and prefer not to eat, and that are found in the standard American diet in abundance. So we need the omega-6s because they are pro-inflammatory, and we need some inflammation. We know inflammation is a natural thing in the body. You cut yourself, you want an inflammatory response. You injure yourself, you need an inflammatory response. That's great. But very often it goes beyond that, and we are very inflamed, and that is not healthy. And it's countered by the omega-3 fatty acids. So you only have two numbers to remember: the omega-6s, the omega-3s. The omega-3 fatty acids are the ones from fatty fish, avocados, fish like mackerel, salmon. And if you're vegan, there are other forms, like they're really coming from algae, and the algae is eaten by the fish, and the little fish are eaten by the big fish, and that's how we get our essential fatty acids. But the way we get it in our supplement supply is in the form of oils that you take by the teaspoon or you take in capsules. And they are anti-inflammatory, and in this day and age, they are essential, really essential. So all the chronic diseases are diabetes, heart disease, obesity. We're seeing just a plethora of these, and it's really scary, and it has to do with the imbalance of the omega-6 to the omega-3s, which is supposed to be 3-to-1. 3 omega-6s to 1 omega-3. And what it usually is something like 15-to-1 or 20-to-1. That's too high, so we have too much pro-inflammatory versus too much anti-inflammatory. And 97% of the population is actually in that range. And this may sound kind of science-y and medically, and I don't want to get really esoteric, but the important thing is you need to know your ratio. You need to know what your number is, and you need to be able to correct it. And that's what I'm going to talk about today.
So I think you've just explained, at least to a certain extent, why that is important, but I think there's some other areas of importance as well.
Right. Well, the importance is that if you are more pro-inflammatory than anti-inflammatory, you're going to get affected by the chronic diseases that are really increasing exponentially, and it's really unnecessary. But this is a worldwide problem, although I have to say that in the US, we have the highest ratio, like the worst ratio, and 97% of people have too high a ratio. The good news is we can bring it down. But first of all, we have to know, what is our number? That's how we started. What's the most important number that you don't know? So the good news is you don't have to go to your doctor and get a lab test, get it sent away. We have a blood spot test where you prick the tip of your finger, drop a few drops of blood on a blotter, and put it on this card, let it dry, and send it off to this specific lab called Vitas in Oslo, Norway. They're a highly specialized lab. They're used by NASA and some of the major university centers, and they're particularly expert in measuring blood spot tests, and they will give you your ratio.
Are there other ways that we can get to that point?
To do the measurement?
Yes.
When doctors do blood tests, they may measure something. They may measure your omega-3s. They may, if they're getting more esoteric, they may measure your 6-3, but they don't give you the kind of readout that you get from this company, which gives you 11 different oils that you have inside you, what the proportion is, and how to correct it. So this is the focus. This is all that they do with this oil. They have developed, this company Zenzino has developed a very specific oil. So when you take fish oil, we have to clean it. There's mercury and chemicals, and we have pretty polluted oceans, which gives us pretty polluted fish. So of course they have to be cleaned out. The problem is that when you remove the chemicals and the mercury and the metals, you're also removing polyphenols. And again, another word that needs explanation. Polyphenols are major antioxidants that when they're in the fish, they keep that fat from oxidizing. Oxidizing is like what happens to rusty nails. You take a nail, expose it to dampness, and it rusts. The same thing, we rust inside, we oxidize. And the point is to prevent that oxidation. And the way that's prevented is to add polyphenols. But you can't just add polyphenols to the oil and then it's voila, going to work. No, there's a very special patented process where this cleaned up oil is then bonded very specifically with a tight bond to polyphenols from young olives, which are particularly high in polyphenols. And these polyphenols bond to the fat cell, and it goes into your body, and the polyphenol pretty much escorts that fat cell, the fat into your cell. So you have a direct route into your cells, which are really needing this fat because our cells are made out of fat, especially our brain cells and our heart cells. And when we don't have enough fat, the cell wall is brittle, nutrients can't get in easily, and toxins or waste products of metabolism can't get out. So you have a system that's kind of clogged up. When you have this bonded combination, the oil goes right into the cell wall. The cell wall is nice and pliable. Nutrients go in and toxins come out, and you have real circulation of essential fatty acids. And you become much healthier, much more anti-inflammatory. And what's interesting is there's a turnover of the red cells every 120 days. So when we test and then put someone on the oil, test again in 120 days, because that's the turnover rate of a red blood cell. When we do that, we can see what the difference is, what the delta is between what you started with and what you end up with. I know when I did mine was, and I thought I was doing pretty well. I eat organically. I don't eat crap. I avoid seed oils as much as possible. My ratio was 5.7 to 1, which is a little out of balance. I took the oil for 120 days and it came down to 2.7 to 1. That's under 3.1. That's in the healthy range. It's the good range. I was very happy. But more than that, I had more energy, better focus, just felt better. And I had one patient, this was really remarkable. And I don't like to be dramatic because medicine usually isn't dramatic. Things happen in the course of time. But this one woman had labile hypertension, which means her blood pressure would shoot up. As soon as she got the least bit excited, her blood pressure would shoot up. She'd measure it, and she'd get even more upset, and that would drive it further. And it was a vicious cycle. Anyway, she started the oil, and she said her blood pressure stayed down all day. She felt much calmer. She had more energy. She also used to spend a lot of her time in bed because she had to rest. She didn't have enough stamina for a whole day's work. Well, almost immediately she began doing a full day's work. She could go out in the evening, and I was amazed because it's a woman who was, I hate to say this, but she was always complaining. It was always, oh, I'm so tired. Oh, my blood pressure. Oh, and it's kind of hard when you're a doctor and someone just isn't getting better, and she wasn't being totally compliant, and this just it fixed her. And this is 2 months later, and she's still doing much better than she did when she started.
And I would imagine, Dr. Cass, with everything that you've said, it really comes down to maintaining a healthy diet.
Absolutely. That's us. We're made out of the food that we ingest. And if we ingest junk, we turn into junk. You eat the seed oils, you're going to be pro-inflammatory, you're going to gain weight in the wrong places, and you're going to be a great risk for heart disease, diabetes, Alzheimer's. And for me as a psychiatrist, I'm really excited when I see the changes that happen in my patients, because people that are ADD, even if they're already taking fish oil, this is like fish oil on steroids. There's not really steroids there, but it's like a really effective fish oil. And the ADD people, ADHD, calm down, say they have better focus, smoother energy, can concentrate better. So I'm happy. Even people, and these people who may have been taking some good organic essential fatty acids, like a few capsules a day, really good professional brands that we all like. They weren't just buying any old oil, but it really was a 180-degree shift for them.
And I would imagine, Dr. Cass, that there are, in addition to the omega products, supplements, there are other supplements that one could take to, in essence, fix the problem.
Well, I think to get enough omega-3, you need to eat omega-3. But you can eat fish, for sure, eat fatty fish. But you can't really get enough. And you really have to have the right ratio of omega-6 to omega-3. And you need the polyphenols. And because this product has the polyphenols, it goes into the cell and it really works. It really does its job of quenching inflammation and allowing nutrients to go in and out of the cell. And so many people have brittle cells that are impenetrable. And so what we have here is not just a fish oil, it's really like a Mediterranean diet in a bottle because it has the polyphenols built in. So I had another guy, he was taking, hard to believe, but he was taking a very reputable brand of oil, eating organically, exercising, And his ratio came out 17-1, which you don't want to happen. It's really high. And he was like, oh my God, he was shocked. So he took the oil in 120 days, he measured it, and he came down to 2.1-1. And he was really excited because it wasn't just the numbers. We're not treating numbers, we're treating people. And we're looking for an improvement in symptoms. Those are the indicators of what's going on under the hood. And he was more focused, he was more organized. This was a guy who tended to be kind of scattered. And he was able to be more successful because he was so much more focused and organized. So he was excited. I was excited for him.
Very good. Very good. Dr. Hyla-Cass, thank you for giving us some great information and joining me today on Healthy Bytes.
Thank you. And for some follow-up, if you want more information, and I'm sure you do, go to my website, cassmd.com/zinzino, ZINZINO, cassmd.com/zinzino, and you'll get a free lifestyle booklet and free information on how this works, including a number of videos and how you can get a blood spot test and test your ratio so you'll know your number.
Thank you very much. And thanks to all of you for watching Healthy Bytes.